had, Thomas just said, I got the wind knocked out of me and went back into the game, it could have been a lot worse for him.
What looked like a routine football play was actually the start of a medical emergency. Coming up, that hidden injury. We meet one of the only people in the stadium who realized just how serious it was. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. On a Friday night this past September, Thomas Hoskins had already scored 2 touchdowns for his Blue Valley Tigers. But after this play, he would need to leave the field and eventually head to the hospital. From this angle here on the video, hard to see really that anything is wrong once it happens. But on the sideline, athletic trainer Caitlin Truhe noticed that something was wrong with Thomas.
I saw the pain on his face, and it just seemed different. A kid that gets the wind knocked out of him is going to have a shocked face, and they're going to be gasping for breath, whereas an athlete who has some sort of other injury might grimace.
I knew it wasn't the wind knocked out of me, but I told my coach that so he wouldn't be worried about it. And then Caitlin came over, and I was like, it's definitely not the wind knocked out of me. Like, I could feel it was something different.
The Blue Valley School District recently acknowledged Caitlin for averting what could have developed into a really serious situation. So what was wrong with Thomas, and what did Caitlin notice in that moment? And also, what role does professional athletic trainers play in a high school football game? We're going to ask Caitlin herself. She is joining us virtually this morning. She is a certified athletic trainer with the University of Kansas Health System, but she's not typically here at the hospital. She has been embedded and on the sidelines at Blue Valley High Schools for years now. And we also want to welcome Doug Wiesner right here next to me. Doug is the program director of the health system's youth sports medicine program, which includes trainers like Caitlin in several different school districts. Good to see you, Doug.
Thanks for having me here this morning.
Yes, yes. And then also joining us remotely is a student athlete, Thomas Hoskins, and his mother, Talisa. How are you both doing today?
Great. Good morning.
Great. Good morning.
Great. Good. Thanks for getting up early with us. We appreciate it so much. So I'm going to remove some of the mystery and explain that play that we're seeing here. Thomas sustained an internal injury. He tore his spleen, but that kind of injury, as we know, really wouldn't be immediately obvious to most people. Thomas, how did the injury happen? Take us back to that moment, because you were having a great night, but then this happens. Describe the pain to us.
Yeah, so what happened was I went up for a one-hand catch, and then I came back down the other way, and I had my hand with me to help me fall, and my elbow went up under my rib cage, and I just felt this like tight little pain that I've never really felt before, and I knew it wasn't the wind knocked out of me because I could breathe perfectly fine, but it was just this tiny little pain that it wasn't super painful or anything, but I just knew something was wrong.
Again, quite a game you were having. You had the highlights from 2 touchdowns that you had earlier in the night. That must have felt great. But then after this injury, you told your coach again that it was the wind knocked out of you, but you were feeling that there was something more. Caitlin, did you notice immediately that something was wrong? Tell us what you saw that maybe the rest of us wouldn't immediately notice.
Yeah, so what I first saw was really Thomas landing on his arm. And it was in an position that I was like, well, he could have injured his arm or maybe even, his rib. And then you start thinking, well, you also need to check for those internal injuries because, some things can happen. And on the sideline medicine, you're really kind of ruling out emergency cases and kind of working your way down into, something hopefully less urgent.
So, yeah, you described it, but go again, like, what's that assessment? You see this happen. And you've got so much going on the field. I'm always thinking, what if you missed the moment? So you're kind of like having to really assess him as he's getting up and walking to the sidelines. What are you doing in those moments, kind of play by play, if you will, on your end?
Yeah, so with Thomas, seeing his injury, I started to walk out towards the field almost immediately, and the referees kind of beckoned us on. I was almost halfway out there, I think, at least in my memory, and just to assess him. And Coach being out there, and Thomas had told him that he got the wind knocked out of him. And I looked at Thomas, and he said that it wasn't, and I kind of knew based off of his face that there was something more. And then I took him off to the sideline, and I assessed for rib pain and and any other soft tissue pain. And then that kind of all was negative. And so I was like, well, something else is causing him pain. We need to really get a further assessment. So we took him off to the sideline, off to my treatment table, did a further assessment, and I called Dr. Lisa Vopat, who was also on our sidelines on Friday nights, over to assess as well. And we kind of took it from there.
And you decided eventually he needed to go to the hospital. What went into that decision? I would imagine you don't take any chances when it comes to these kids.
Yeah, no. So we did the sideline assessment, and it was still inconclusive. We kind of had our, suspicions that something worse was going on, potentially the spleen injury. And so we let him go back into the locker room and take his time, because he thought that, he needed a minute and may have to go to the bathroom. And the Dr. Vopat and myself, and we actually had two of our residents as well, kind of conferenced our next steps, and said if he got worse at all, we were going to call EMS. And sure enough, Thomas got worse and, showed the cardinal signs for a spleen injury. And then we activated our emergency action plan. And, my administrative staff, the coaches, everyone played the role that they were supposed to in getting EMS to him. And, we managed his pain as best we could with what we had on the sideline, and got him to care.
So, Doug, I can't imagine. This sounds exactly like the whole reason that this plan and this program exists is for something like this, when this happens, to have a professional there on the sideline. Kind of explain the genesis of this program and how it all came about.
So our program is in our 12th year. And so, when I came on board, they said, we wanted you to start this youth sports medicine program. And I had been in the community at different high schools. I started in professional sports and kind of had my fill of that. But I knew that the high school community especially wasn't receiving the care that they needed. And so when I came to the University of Kansas Health System, I said we need to put an athletic trainer in each high school and dedicate one, because we used to have a jigsaw puzzle of athletic trainers, 2 to 3 o'clock go to this high school, 3 to 4 o'clock go to that high school, cover this thing here. And so the health system was 100% behind it. And so we went out and secured our first contract with DeSoto School District, put 2 athletic trainers out there. A couple of years later, all of a sudden, we reached out to Blue Valley, Shawnee Mission, St. James at the time, and eventually to Lansing High School. And we have those schools under our coverage umbrella, with the exception of St. James right now.
Well, I was just trying to think about when I was in high school a little bit ago, and we're trying to think, what would that have looked like? I went to Friday night football games, and I'm trying to think, well, who was on the sidelines? Was it just coaches or parents left to say, hey, you feeling okay? What did it used to look like, and what are we trying to get to?
Well, it used to look like coach, go out there and take a look at that. And that's a scary situation today. No offense to the coaches. And the coaches didn't like it either. They didn't want that responsibility. And so a long time ago, when I went to high school at Oak Park High School, I was fortunate to be sent to a camp that taught me basic first aid stuff. And so I was able to bring that. But that's all you had in the high school environment back then, is you might have a student that might be interested in some first aid stuff. And so eventually that has progressed, and we've seen the need, and we've seen where parents, they come up to you and they say, without saying it, I'm giving you the privilege to take care of my kids, my sons and daughters. Please take care of them for me.
We owe them more.
Right. And I tell my staff that we have a privilege that the parents are giving us. And so they wanted their kids taken care of. And so it eventually escalated. And, obviously with the Damar Hamlin situation, we saw that nationally almost a year ago, what happened there. And so we don't have that type of coverage, unfortunately, 32 medical experts out at our games. But at our Friday night home varsity football games, Dr. Lisa Vopat, I have a plethora of physicians that do coverages at our high school Friday night football games. And Caitlin was fortunate that we try to branch out to PM&R, family medicine, orthopedics, obviously. Emergency medicine now is coming to our sidelines. And so not only did she have the benefit of Dr. Vopot being out there, but she also had some residents that are skilled in emergency medicine that were right there to say, we saw this yesterday.
Right, right.
We see a lacerated spleen maybe once every 5 years.
Right, who would see that? I mean, your average person isn't going to see that. And all those people are really important. But Doug, I have to say there's nobody who's more of a first line of defense for a kid than their mother. So I want to bring in Lisa to just ask her a little bit about what were you doing when you got word? Were you at the game, first of all?
Yes, I was at the game. And when I saw him get hurt, he had hurt his ribs a couple of years ago. So I actually thought it was maybe his ribs again or collarbone. I did go up to Caitlin when they were going to the locker room, and I, asked her what was going on. I thought that the wind knocked out of him, just what I could see. And at that point, she said, well, maybe, but we are concerned about his spleen. So she actually told me right away that could be a concern. And then, I waited. Of course, I didn't go in the locker room at that point. And then an administrator, the athletic director or whatever, called me on my cell phone and just said, you need to come to the locker room. We're going to take Thomas by ambulance to the hospital. So, and of course I got in there, Caitlin was in there, and then the doctor that you just mentioned. And so I felt I felt like we were in very good hands. So I did not feel super worried and stressed because they were all very reassuring that he was getting the attention he needed. And so I think they're invaluable, both Caitlin and the doctors that we are fortunate to have at our games.
Huge peace of mind for a parent. Hang tight. We're going to learn more a little bit about when Thomas, and we're going to hear from you, Thomas, about when you were ushered off into the ambulance and off to the hospital here in just a moment. Anyone watching can ask questions to any of our guests today. Just use the chat on YouTube or Facebook, tweet us, or email the Medical News Network. Info is right there on your screen. It is Monday, coming out of the weekend, so let's get a new COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning.
Hi.
Good to have you back.
I'm back.
You're back.
Was in a little bit warmer weather, not too much, but a little bit cooler today. Obviously, we've gotten some precipitation, which is good. It's well needed. But as far as the COVID numbers goes, here at the health system, we do have a slight increase of 19 active inpatients. They range from actually 7 weeks old to 86 years old. We do have 5 in the ICU as well. So just a slight increase, unfortunately. We'll see what the next couple weeks brings. And hopefully later this week, we'll also have some influenza and RSV numbers for you as well.
All right, Huck, we've gotten some questions about an uptick in pneumonia cases in several places around the world, including headlines out of China and Denmark and now Ohio.
Yeah.
The common link appears to be what's called mycoplasma, which is a bacteria. So what is mycoplasma, and are you concerned about this spike?
Yeah, so first of all, not too concerned. Obviously, when we have increase in cases of anything, we always have to be vigilant and monitor and understand what it is and what might be driving it. In these cases here, they are talking about a bacteria called Mycoplasma pneumoniae, which can cause pneumonia. And if you look at some of the news articles, they'll call it Mycoplasma pneumonia. That is actually the disease entity. We know pneumonia can be caused by various things like bacteria, like viruses and fungi as well. This is a bacterial disease. This is not new. In fact, one of our infectious disease physicians, really the infectious disease physician that helped start the ID division here at the University of Kansas Health System and at University of Kansas Medical Center was Dr. Chen Liu, and he was here very early on. He was the mentor to my mentor, Dr. Daniel Hinthorn, and he actually helped identify and be able to replicate the ability to study it and grow it in the lab. So he was very essential for that. But it is a bacterium that we've known for a while, and it causes what most people know as walking pneumonia. It is a bacterial infection, like I said, so it can be treated with antibiotics. We do have good antibiotics to treat it as well. But we also mentioned what is going on in those places. So certainly those places like Denmark and China, they've noticed an increase in cases since early in the spring, like April and May. So this is a little bit different, but it also is combining with what China has seen with overall increased respiratory infections in their children. So it is a combination of the viruses and this. And then, of course, Ohio has a little bit of an outbreak of this as well. It is really not poised and not expected to become a worldwide pandemic. Again, we have very good antibiotics to treat it. Most people are familiar with those antibiotics. Things such as a Z-Pak or doxycycline are very common and used for treating this. But it is important that if you or your child or loved one continue to have ongoing fever and cough, maybe malaise, which is feeling bad, obviously go get evaluated by a physician. They will probably examine you, take a chest x-ray, and then determine, do they think you have this Mycoplasma pneumoniae pneumonia. And again, we do have very good antibiotics to treat it, but it's always important to get evaluated by a medical professional.
All right, Hawk, thanks so much. Okay, we're going to pick up where we left off with Thomas and Talisa. Talisa, it had been alarming to see your son loaded into an ambulance. Thomas, what was going through your mind?
Well, on the sideline, I really wasn't nervous at all because the pain level wasn't bad, and I was just worried about the game. But once we got into the back and the ambulance was starting to load me up, you know, I was really scared. I was just trying not to have a panic attack, just trying to calm myself down and make sure I know that it's going to be okay.
Sure. Yeah, I can imagine. Talisa, tell us what happened once you got to the hospital. Was surgery needed? What was the care like? What were you being told by the professionals there?
Yeah, well, they took us right in, of course, and did a CAT scan and a few other tests. And they did determine he had some internal bleeding, but did not require surgery, and that his spleen had been lacerated. So the care we got was awesome. And we were really glad that he didn't need surgery, because that would be a lot harder recovery and more difficult. But yeah, they got us on the mend right away.
So, Thomas, what was recovery like?
There really wasn't any hard recovery. I just had to lay in bed for 3 days, and then I slowly was able to walk around more. And then after a couple weeks, I was able to start jogging, and then eventually I was able to fully recover and start doing everything I was doing before.
Including football?
Yes, I was able to return to football after 6 weeks.
So, Caitlin, I want to bring you back in here because you develop these relationships with these kids and the parents. Tell us a little bit about what that's like. You're not just treating a student. You really, it's a full family affair when you're talking about, caring for someone's kid.
Yeah, Doug took the words out of my mouth earlier. It really, truly is a privilege to work with these kids. The parents do put trust in us, because a lot of times I'll work with the athlete and I haven't even met the parents yet, and so the first time I'm calling them is to tell them about an injury that their son or daughter may have. But I will say, working with the athletes and getting to see them play on the field and be participating in the sport that they love really is what makes my job so much fun. I hate to tell kids that they can't play, but when they get to return, it's just really sweet. It's really nice.
Yeah, this full circle moment. So, Doug, tell me a little bit about what it's like. You developed this program 12 years ago, and then here you are watching these moments happen and these successes where these trainers that you brought in are doing exactly what you intended this program to do.
Yeah, it's when we went out to Blue Valley School District and received the award, unlike here, I was kind of lockjaw. I was just so proud. You see that full circle moment, and you're just so proud because, yeah, here it's actually playing out. People are starting to recognize what the athletic trainer is and what they do, and how they impact not only the sport but each and every individual. I think Caitlin will tell you that she has the rapport at Blue Valley High School. They did a study a few years ago, and Caitlin, you're going to have to remind me of this, where they said if there's an emergency, who's your go-to adult in the building? And how many said, I'm going to go see Caitlin. Caitlin's the person I'm going to go hang with. And you hear those stories, and you sit up a little bit taller.
You're a little puffed up and
stick your
proud.
chest out, and you go, yeah, that's
my girl.
That's exactly the way we want this to go. We put the athletic trainer in the schools, and we want them to become a part of that fabric of the school. Sometimes they feel a little disassociated from the University of Kansas health system, but it's so important for them to be embedded and become part of that community and those relationships.
And Talisa, you have other kids and other students, and so you already knew Caitlin before, right?
Yes, that's correct. Thomas is my youngest of 5, and 4 of my kids all played some high school sport: golf, softball, basketball, baseball, football. So I think I started meeting with Caitlin after she came to Blue Valley. And so we've had a lot of conversations over the years with things. And, I always just feel awesome that I mean, I don't really know the other trainers, but I know she's amazing. So
yeah, friend of the family for sure, it sounds like.
Yeah.
Doug, I do want to ask you really quick about the action plans and the training that you guys do each year.
Right. So we do emergency action plan training 3 times a year. And so we start them in August, and because football is such a monster, we prepare for the Damar Hamlin situation. Face down, unresponsive, no breathing, no pulse, go. Take care of this. It's also a hot time of the year, so we get into exertional heat illness and cold water immersion and those type of things. Last month, Caitlin was instrumental in this, in putting together a mental health action plan. And so each high school, each middle school that we cover has a mental health action plan. So if somebody's in mental health crisis, what are we going to do? Who are we going to call? Who are our resources for this? And so Dr. Brett Woods, our sports psychologist, came in last month and addressed the team and gave us 3 different scenarios to go through and practice. And we'll practice that a little bit more. But then Michaela Meyer, who is our athletic trainer at Hawker Grove Middle School and with Chiefs Cheerleader, is in charge of setting up the scenarios. And so we'll have a 3rd scenario at spring break week. I don't know what she's putting together yet, but we take examples like this, like what Caitlin and Thomas went through, and we always go and do a debrief at our monthly staff meeting, how many EMS calls. And so from that, we get an idea, okay, we're seeing a lot of this, we're seeing a lot of that. Helps us lead us into the direction that we want to go with our emergency action plan training. And then over the summertime, the health system, sponsored through the 101 Awards, sponsored a big emergency action plan training where we had 10 to 12 physicians from the health system speak, and then we were over on the Lawrence the KU campus over in Lawrence, and we had about 150 medical professionals come in and taught them emergency action plan training.
Something else that's evolved since you and I were in high school is when you mention mental health. I mean, that's just not something that's that was really honed in on. So to hear that Caitlin's like, you know what, we're going to treat the whole the mind, the body, the soul, the whole student.
Yeah, she was the ramrod to the whole thing. She, I know she did a master's, her master's on it, but she came in and she said, we need to have this, and we went, okay. Caitlin's got another idea, so let's take this one.
Let's listen to her.
We listened to it, and it's helped out tremendously.
Caitlin, why did you feel that need was so important at that time?
Well, prior to COVID, actually, that I came and brought it to their attention. But like Doug had said, athletes do come into the athletic training room and share, stresses about their life, and some of those can be mental health crises, and I'm seeing more and more of that. And luckily, I was able to, with my own personal experience, handle those individual situations. But I was like, what if this gets worse and something that I'm not comfortable handling? Like, who do I need to contact within the health system, but then also within the school district? Because these minors, how do they want us to communicate with parents? So really, I just wanted answers for myself. And that kind of sparked this, well, does the community need it as well? And since COVID, I'm actually going to go and talk at our national conference in June. Nationally, in the athletic training community, there is a need for these mental health action plans, and the conversation is just getting going.
Yeah. Guess what? We're going to get you back on the show for that. How's that sound?
Great.
That conversation's ongoing. Just a couple quick questions for mom and son again. Talisa, does this make you take pause when these kind of things happen? I know you got 5 kids and they're very active in sports, but when something like this happens and you see your kid on a stretcher going into an ambulance and off to the hospital, kind of talk to parents out there, help them through like kind of that mental aspect of what that's like. And, do you keep going? Do you take them out of sports? How do you do that? Find the balance.
Yeah, I mean, it is, of course, stressful and worrisome. And I've never removed any of my kids from sports with injuries. I know it's just part of it. I was an athlete as well, so I know it's part of the game and the situation. But it is stressful, and I think that, as long as you have good medical assistance and help, then your kids are going to be fine. And again, I know a lot of schools don't have the resources that we do with trainers, but it would be nice if they all did, because it is a really good peace of mind knowing you've got somebody there that knows what they're doing.
For sure. Thomas, what's coming up after high school when you graduate? What's the future plans?
Currently undecided. I'm looking
Fair enough.
at where football or not, what college I want to go to, where I'm going to get the most money.
I like it. I like your thinking. It's all good. So we want to get to some questions from our viewers, if we can, today. Bruce wants to know, what if an athlete is trying to hide or downplay an injury, Caitlin? How do you handle that? Again, this goes back to the mindset, because kids want to hide it from their coaches. Is it just the wind knocked out of me, or is it more?
It depends on the situation, right? Sometimes coaches come to me and they say, hey, he's hiding something from you, or she's hiding something from you. And then from there, I can ask more questions and kind of get truth. And really, sometimes also there are some cases, especially with Thomas, if he wanted to say no big deal, his face and body language, just knowing him and having that previous relationship, knowing him from freshman to senior year, I'm able to see those body language signs that say that something more is wrong. So really having us integrated into the school is beneficial, because it does help with our treatment and care plan of these athletes and catching those kids that want to hide injuries. I have been known to take some helmets and put lock pads on them, because we've had athletes try to go back onto the field because they're fine when they're really not. So just all depends on the athlete and the situation, but we try to catch most, but we can't catch them all, unfortunately.
Last question is, are the trainers able to see across the field at the other team and help? I mean, what if somebody like Caitlin sees something, and do they help the opposing team?
Oh, absolutely. I mean, so we have a medical timeout, just like the NFL has a medical timeout. And so Caitlin will, if she's the home team athletic trainer, she'll run a medical timeout and get with the opposing team. Is there an athletic trainer there? Is going to be a physician there? The referees will show up. Sometimes the school administrators will show up. And they'll go through and find out just exactly what that visiting team has. There's no athletic trainer. There's no team physician over there. There's coaches. It becomes her responsibility to take care of all that stuff. They may wave at her, they may do a walkie-talkie and tell her, we need your help over there. So Caitlin, double work, but Caitlin's there to take care of those kids as well. We don't want to see kids hurt. We want to see a nice, good, competitive football game or whatever sport we're covering, but we don't want to see the kids get hurt. Like Talisa said, it's going to happen. That's the importance of having the athletic trainer there. And so if if our staff is the only medical staffing at the event, they will take care of.
Stepping up.
Yeah.
I want to get our takeaways today. Doug, for folks listening, parents, students listening, what's the biggest takeaway from our chat today?
Well, get to know who your athletic trainer is, because at some point in time, your child is going to access that person and get to know what they have accessible to them. Get their phone numbers, their emergency contacts, so that when you get a phone call 9:30 at night and you go, I don't know who this is, and you don't answer it, you answer that phone call. So I would say the most important thing for parents is know who your athletic trainer at the school is, and then find out what they have available to
Right,
them.
like what Talisa did with Caitlin. Caitlin, what's the takeaway today?
Doug took mine.
I know, he always does
it's
that.
Important. Really, I do think it's important to have a relationship with your athletic trainer, get to know what medical resources you have at the school, because it helps us. It helps us to treat your athletes and to give you guys the best care, to know each other, really. It's all about relationship building as much as it is about, potentially saving their life.
Well, congrats on the acknowledgement from the school district. Job well done. Caitlin, thank you so much. Thomas and Talisa.
Thank you.
What is the takeaway from your personal story?
Well, I'll just echo what they've said, and to the point from a parent's perspective, when you do have a personal relationship and you know the trainer like I do, you actually trust them and you trust what they're telling you, as and Thomas does too. So I think it's knowing them so that you trust and believe what they're telling you when something's going on with your kiddo.
All right, Thomas, wrap us up.
I that I'm very Caitlin, that she was there, takes good care of me, and she's just been an amazing person for me throughout my whole high school career, and she's very amazing.
Thank you both for sharing your story. We appreciate it. Stay healthy, stay well. And thanks to all of our guests. Thanks to our viewers for being with us today. We'll see you back here tomorrow at 8.
Coming up on the Morning Medical Update, Chris Schwab collapsed on a cross-country flight. He needed a blood clot removed from his brain, and he needed it quickly. I'm Alexis Del Cid on the next Morning Medical Update, the urgent rush to save his life, and how popping his neck might have triggered the emergency. Tuesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.